Good morning and welcome to the talk show from Ashoka Medicover Hospital, Nashik. I am Dr. Akash Chaudhary, medical head of this institution, and our guest for today is Dr. Chandrakant Chavan, and he is the chief of our emergency department. Welcome, sir. And the topic of our discussion is effectiveness of emergency department and early prognosis of the disease. And my first question is you to what is the difference between casualty and emergency department?
Emergency nowadays has emerged as a separate specialty in which a doctor who is trained in all emergencies, handling all the emergencies, is capable of taking decisions and initiating the treatment without involving all the consultants on the first hand. Once he diagnoses and starts the treatment, he will give the update of the patients. Whereas in casualty, it was like you see the patient, you discuss with the consultant, then take the decision. So here there was a delay in the treatment. Whereas a properly trained emergency physician will initiate the treatment, then will think about the disease prognosis.
Okay. And my second question is to what is golden hour treatment?
Well, golden hour treatment, like Dr. Akash, any treatment if initiated as soon as possible, the outcomes are pretty good. So let's take an example of stroke and heart attack. If a patient presents with stroke, there is a golden hour called as 3 to 3.5 hours, which if you give a thrombolytic agent, the outcome of the patient is really good. Whereas if you delay it, you might have seen patients staying on bed for ages together. And you must have heard people recovering within a span of 1 or 2 days. So this initiation of golden hour treatment matters a lot. Because in stroke, the more time you waste, the more neurons get damaged in the brain. Whereas in heart attack, early reperfusion therapy, such as there is a block due to which you get a heart attack. If you clear that block within a span of 1 to 2 hours, the outcome is excellent. Whereas if you delay it by 12 hours, 24 hours or more than that, eventually the heart will become weak and it will end up in failure. The quality of life is not that great.
Okay.
So golden hour treatment matters a lot in any condition. Let's talk about infections. Early administration of antibiotic has been proved to reduce the hospital stay of any patient. So this golden hour concept is very, very important, and it's been implicated in all the emergency departments nowadays because the emergency physician who is trained to handle all this is exactly trained and knows what to do, which drug to initiate. So golden hour treatment and having a trained emergency physician, you see excellent results in the patient's outcome.
Okay, thank you. And my next question, it is not a question. I want the advice from you. Like, what advice you want to give to the patient's attendant who got panic in the emergency department?
That's a tough question, Dr. Akash sir, because see, it's a panicky situation. Every case is a panicky situation. For a relative perception, for them it's an emergency, no matter how stable the case is. But for us, we are trained to triage the patient accordingly. We see the patient, we assess the patient, then we come to a provisional diagnosis, then we decide. So what advice I've got to the relatives, if you ask me this way, come to the emergency department if it's an emergency, if it's whatever may be the problem. You blindly trust the emergency physician and just listen to him first. Okay, you can definitely give your advices. We will definitely talk to your family physician and referring doctor, but that initial period of assessment, such as let's say 15 minutes, half an hour, whatever it is, allow the doctor to examine the patient and quietly listen to him. You can ask whatever questions you want to ask, but the only thing is trust your emergency physician. That is the only thing I've got. Yes, you can Google your symptoms and you can do whatever you want, but that all discussion we can have later once we stabilize the patient.
Okay.
So my only idea is like, do not hamper the assessment of the emergency physician. Let him take care and listen to him first. Later we can have a discussion about whatever you want to ask. So that's the only thing which I wanted to do.
Okay, it's being a nice talking to you. And I also want to give advice to the citizens to trust our doctors. We are here to help you all. Thank you. We will meet on the next time. Thank you. Thank you.
Thank you, sir. So stay safe, wear mask and get vaccinated. Please follow the precautions whatever have been advised by the government.